glad to invite Judith Wahl to come up, lawyer with the Advocacy Centre for the Elderly. She's the executive director. So the Advocacy Centre for the Elderly is a great resource that provides advocacy advice and support for patients, including those facing huge hospital bills for their beds, or seniors in the facilities, or those with problems accessing home care. So they do an amazing job. We're really glad you came.
So as I was introduced, I'm a lawyer, and it's been interesting, these issues that we've been dealing with, what I'm calling the first available bed policies in hospitals, which we take the position are all illegal. We've been dealing with them for actually 10 years. So this is an issue that's been going on for a long time. And what I'm going to describe to you is the legal framework that our analysis of what the law is right now in respect to patients' rights. I'm not even factoring in all the things in terms of the restructuring, because I don't know all the nuances yet of what is going to come down with the restructuring in terms of legislative change, whatever. But right now, what the situation is, I'm going to talk about, in particular, what I'm calling first available bed policies, patients' rights on discharge out of hospitals, issues about where can people be placed, so the role of alternative places like retirement homes in this, in terms of a place for placement. I can tell you in all the cases we've done for the last 10 years, and I'm going to tell you right now, we're doing them daily. This is an issue every single day in my office, my tiny little law office. We have 5 lawyers, 3 support staff. We get what we call first available bed cases. Always somebody's calling saying, my mother's being told she has to get out of the hospital now to the place that's 200 kilometers away. Does she have to go? We're being told if she doesn't go, she's going to be charged $600, $800. I think the new all-time high is $1,600 a day. Terrifies people. And you know, we're taking position it's all illegal. So I'm going to give you all of that idea. I'm going to tell you, we're not just advocating for individual clients. Based on all the cases we're doing, we've been trying to do systemic advocacy on this issue. We actually met with Dr. Smith this summer, who is in charge of the ALC committee. He had told us that we could be on it. He never called us again. We gave him our analysis of this, never gave us any comments. We commented on his previous report that wasn't public, that somebody had slipped to us, which I think was heavily flawed, that called for things like using retirement homes. And of course, he never made any comment to us after that as well. So I think there's a lot of flaws. All the things I'm saying, we have a paper on this. I don't know if it's on our website, but I'll make sure by Monday that my web person will put it on. But we certainly have newsletter articles that are on our website right now that also explain this. So what's the framework? Typical situation, we've got a patient in the hospital, usually a senior, because that's who I deal with, is the seniors. But it's not just limited to seniors. We've had clients that are much younger. I have a young man who's in his 20s who's in a hospital was in the hospital in Belleville, and the only place that he was being told that would be available to take him was near the Kingston area. Low-income family. He would never see his family again. This man's already lost a lot out of his life because of his severe illness. This is not fair in our perspective for him to transfer to that far a distance to be away from family and friends. So you got the patient in the hospital. They've been there because of an acute episode. So now the acute phase is over. They're assessed as being eligible for discharge from the acute care. That's another side issue is how are people assessed as eligible to get out of acute care? We recently had a case where somebody was in a coma and they were told that they could go home. And this was a woman, her husband was in his 80s. How is he going to take care of her? Anyways, so what are the options for that person who no longer needs acute care? They can return home with home care if it's available. Now we know there's waiting lists for home care in a lot of areas, or there isn't enough home care to provide for people to the needs they have, because in many ways these are people not just needing some supplemental care, they need a lot of intensive care still on an ongoing basis. The other thing that they can do is go to some alternative place to receive the care. And in my books, retirement homes are not that. Retirement homes are tenancies. They are not health facilities. They are not under any health regulation. They are landlord and tenant situations defined under the Residential Tenancy Act. It was a case that we took many years ago that confirmed that principle. And people private pay for their care services. It's a very important part of our housing system, that housing with care, but it is not equivalent to a long-term care facility and it's not a health facility. The other option is they can go to accommodation with care services. They can go to long-term care, assuming that they're eligible for long-term care. And many of the patients we're dealing with are found eligible for long-term care. They meet that level of care need. Now, if they're eligible for long-term care, under the law as it exists now, they have a right to choose. They can consent to places where they go. In fact, the Lovely Ministry website has all the homes listed with the number of infractions under the various pieces of long-term care legislation. It was there to give transparency so that consumers could make a choice. Yes. So they have a right to choose. They can choose up to 3 places to be on waiting lists for. This is all in the long-term care legislation as it exists now, and also the new Long-Term Care Homes Act, which is not yet in effect. Now, they can choose any homes, and they don't have to choose 3. They can choose 1. We always encourage people to pick 3 because the options are pretty limited nowadays, and we're not stupid. We do want to get people out of hospital. Hospitals are not great places if you need long-term care. You don't get the socialization. You've got all the risks of the different diseases, like we're always talking about MSRA and all those other things. You're not getting the full range of care that you need. You do want to get out, but there's a lot of reasons why people make certain choices. So people are entitled to make up to 3 choices. Now, these are not choices that the hospital can make for the patient. So we've seen the hospital saying to people, we're going to pick for you which places you can go, or you can only pick from short lists, or you got to pick 1 from a short list, 1 from a long list, and the hospital pick 1. All those variations are not legitimate. People have the right to choose whatever places they want, up to 3. Now, then they have to consent. This authority for the consent for the admission is right in the existing legislation. It's in the long-term care legislation and our regulations. Now, we also were told when the new Long-Term Care Homes Act was being created, Minister Smitherman, who was then Minister of Health, we brought up the issue of choice in one of the meetings we had with him, and he said, am I taking away the right of choice from people? Did I say I was taking the right of choice? Because you know that the legislature at any time could pass the law saying you don't have a right of choice. But that's not in the legislation. Because we've always said, you want to do that, take it into the House and debate it. Let's have a public statement about that, and then people will know what the government at the time is doing. This is happening under the radar screen because many people, it's very difficult to protest of this. People don't know their rights when they're in this scenario. They're given the hospital policy and told you have to take the first available bed. So they don't know that they can raise protest about this. Very few people ever get to us, even though I'm saying we get this on a daily basis. And we do get calls from all over the province, even though we're based here in Toronto. So the hospital, under the Public Hospitals Act, the hospital can discharge a patient, and if the person no longer needs acute care. That is in the Act. But can they move them up? This is another issue. Because if that sections in the Public Hospitals Act, we're actually trying to deal with overholding patients. So somebody who just doesn't want to leave the hospital or doesn't want to pay for long-term care. Because in hospital for acute care, you don't pay. If you move it to long-term care, you're not paying for the health, you're paying for accommodation.